Hi everybody, I'm Nelson Moses and welcome to Diagnostic Process and Speech-Language Pathology. This is one of my favorite courses to teach, actually. Why? Because I don't really teach, not in the traditional sense. Traditionally you think of teaching, I think of teaching anyway, as presenting new information, particularly in this field of speech-language pathology, new information either about language acquisition in children or adults, rehabilitation in adults, or one sort of a speech-language disorder or another. New information, not in this class. In this class, Diagnostic Process, I'm asking you, the student, to apply the information that you have acquired across the different classes that you've had up to this point to a problem-solving situation. The problem being the client who appears before you, about whom you have little information. You have some information, but it's going to be up to you to make a decision about whether that individual has a speech-language problem or not. So essentially what you're doing is applying information that you have gathered and garnered already to a problem in order to solve that problem. So my job as your professor or instructor is not to teach additional new information about a speech-language disorder or typical acquisition that I presume you've had or will continue to get from your content, academic content courses. My job is to get you to marshal that information, organize it, and be prepared to apply that information, again, to the challenge of assessing an individual to determine whether that individual indeed has a speech-language problem. So my job is to help you or facilitate your being an active problem solver and help you construct a mental model of this speech-language assessment process, or to apply to the speech-language assessment process. So let's begin, okay? And we'll begin by looking at considerations that guide this process of speech-language assessment. And the first issue we may want to consider, makes sense, why do we actually do an assessment in this field? And I'll discuss that in context of monolinguals clients and bilinguals. This program here at Long Island University's Brooklyn campus is dedicated to addressing cultural and linguistic diversity in the field of speech-language pathology. So we're quite sensitive to the languages that the client is using, and we really need to develop particular skills to address bilingualism. So this course will be conducted from the perspective of addressing cultural and linguistic diversity and distinguishing a speech-language disorder or delay or a problem from issues connected to language or language learning. So let's proceed on now and think about why we do assessments, and let's think about that first in context of individuals who are monolingual. Why assess? Well, if the child, now it says the term child is being used here, but we will be dealing with children and adults, so it should have really said if the individual is monolingual and encounters the same language or dialect in all contexts, monolingual, let's say English, and English is everywhere, and we're trying to evaluate whether that individual has a problem. Why do we assess? Well, the most obvious reason is to rule out or identify a speech-language communication problem. That's our business, speech-language. We also want to determine factors that are contributing to the problem, so we can address those factors. Those factors could arise from the child's speech-language system itself. That's our focus, that's our scope of practice, our domain of practice, the speech-language system. But factors can also arise from non-linguistic behavioral systems or the environment. What do I mean by non-linguistic behavioral systems? Cognition, sensory motor factors, psychosocial factors, medical factors, and again, or the environment. Something about the environment is challenging the individual and above and beyond and leading to a speech-language challenge. I think we all experience that sometimes. Think about it for a minute. But the third very important reason that you may not come to mind immediately is to plan intervention. Because if it was, let's say, a child being assessed and it was my child, if there was a problem, then very next word out of my mouth upon hearing that there is a problem would be, well, the very next utterance coming from me will be what? Yeah, what can be done about it? Is there anything that can be done about it? Can it be cleared up? So to plan intervention, that is the third reason for assessment. And intervention means the derivation of goals and procedures. And keep in mind that when we think about goals, typically we write long-term goals, short-term goals, and session goals. And the nature of each of these types of goals or objectives will inform the kinds of information we seek when we conduct an assessment. Now let's consider the reasons for assessment when we're dealing with individuals who are bilingual. So again, the term child is used here, but we're really in this course dealing with adults and children and adults. Why child? Because my career has been primarily working with children or youth. I do work with adults and have worked with adults, but not as frequently. In any event, so in addressing the issue of bilingualism, we have to ask the question about whether first of all, let's set up a proposition here. The proposition being, if the child or the individual is experiencing a communication problem, and the individual is bilingual or bidialectic, or monolingual, but encounters a different language or dialect in his or her own home, peer, or school environments, then we ask the question, are the problems that the individual is experiencing a function of the interaction between the child's language of learning, or the individual's language of learning, or actually vocational work, and the linguistic communication, cognitive characteristics, and demands of the learning environment. This term, by the way, language of learning, what do I mean by that? Well, right now, in fact, how am I, in a sense, teaching you? I'm talking to you. So we use language to acquire information, or in this class, to construct a mental model. Well, and by learning, I mean learning English, math, science, social studies, Learning the curriculum, acquiring information relevant to the curriculum. Language will be used for that. Well, the question we would ask is, what language is the child or the adult using to learn? Well, the environment in a school that I was working in, PS 241 here in Brooklyn, English, it was a monolingual school. English was the language by which there was teaching occurring, and only English. And the students were expected to learn science, math, social studies, etc. Using English. That was their language of learning. They were expected to learn. But what language we could ask, or is the academic language of the individual? Well, that language may be their L1, and in 241, PS 241, most of the children, or many of the children there, spoke Fulani. That was their L1. Some kids were monolingual Fulani speakers who were put into the school setting when their parents immigrated here to the United States. So at the beginning of the year, they were monolingual Fulani speakers in an English-speaking environment. Their language of learning was Fulani. That's what they were used to learning about science and math and social studies. But in the 241 setting, they had to use English. Or in any event, the challenge of the environment was an English environment. Well, that would lead to speech-language issues, wouldn't it? We were working a literacy program. We were presenting a literacy program. And the reading, we had to ask the question, was that in reading problems of these children, many of these children had reading problems, were those problems a consequence of a language issue or a language of learning issue? The next question we would ask, are the problems the individual is experiencing a function of the interaction between the individual's learning of a language and the communicative demands of the learning environment? These kids who are Fulani, they had to learn English. So language of learning is the language used to learn social studies, math, the curriculum. But language of learning of a language means, the acquisition of a new language. These kids had to do two things at once: learn English and learn math and science and social studies, etc. Well, we have to ask the question, is that interaction between the learning of a language and the demands of the learning environment, is that interaction leading to a communication problem? If so, by the way, then we do not have a language disorder. We have a language learning issue. Different thing. Our job as speech-language pathologists is to differentiate, separate out functional language problems in language and communication that come from some mismatch between the individual's language ability and what the environment is requiring, and an actual disorder or delay, if you're following me. And so therefore, we have to ask the third question, are the problems the child or adult is experiencing a function of what? A specific language delay or disorder? Is it in the so in other words, we need to differentiate between an interaction between the environment and the individual's L1 and learning of a language, and whether what looks like a speech-language problem is really an outcome of that interaction, those stressors, so to speak, or an actual speech-language disorder or delay. And that's quite a challenge. And remember, this is in addition to these reasons for assessment to make these distinctions or differentiations. These distinctions, these are in addition to those reasons for assessing individuals that I reviewed in the monolingual component of today's conversation. So, to review then, all three of the named factors are the interaction between the child's language of learning, interaction between the learning of a language and the learning context, speech-language delay or disorder. We have to differentiate and distinguish among speech and language problems that come from these different potential sources. To summarize, there are many reasons for conducting a speech-language assessment. Each orients us to information we need to derive at a diagnosis, and it also orients us to the process that I will label dynamic assessment. In fact, we have to look at, next up is a look at dynamic assessment.